Welcome to Snip Vasectomy Clinic. I'm Simon Snook, I'm one of the doctors here.
And my name is David Bivona. So in this video we're going to talk to you about what you have to do before the operation, the surgical technique and what the operation in itself means, and then the things that you can do after the operation to recover quickly.
Once you finish watching this video, you'll have another chance to ask questions to one of our nurses on the telephone. And again, when you come in for the procedure itself, there'll be time to talk to either David or myself about the procedure. If we talk about what's going to happen before the operation, a couple of things. Firstly, a question that we get asked probably more than most is whether you need to shave or not for your procedure. And by this I'm talking about shaving down below rather than on your face. And the answer is no, you don't. I mean, if you do regularly, that's okay, but I wouldn't make a special effort to it. It'll just make it itchy for you afterwards, and so it doesn't make any difference to us. You can also eat or drink as normal. This is a local anaesthetic procedure, so that because we don't put you to sleep, it really doesn't matter if you've had anything to eat or drink. It is useful for you to wear some relatively close-fitting underwear, something just to give you a little bit of support, keep the bits and pieces up nice and high. And also, just in terms of when you come in, you're welcome to bring your wife or partner along with you, and if she wants to be in the room with you, and indeed you want her to be there, that's also fine. So for the procedure itself, we use a device called a hyfricator, which works a lot like a laser. So it's very straightforward. Obviously the most important thing is that we really don't want you to feel anything. So the way we do that is we use a local anaesthetic. That's a tiny little injection, and the injection goes into the skin. Another sort of fear from a lot of guys is that we're going to put a needle straight into their testicle. Now we've both got a pair, we wouldn't have a needle in ours. We're certainly not going to put a needle in yours. But we will put an injection into the skin. That'll be no more sore than a local anaesthetic elsewhere in your body. And once that's in, that really is all you'll feel of the procedure, apart from just some gentle movement around in the area. And when you're numb, with this device called the hyfricator, we make a little keyhole in the skin, about sort of 3 millimeters in size, just enough so that we can locate the vas tube, and we can then seal that closed with the same device. So this device means that we don't have to cut you with a scalpel, and we don't have to put any internal stitches in, and the hole is small enough that really we don't need to stitch it afterwards. So when you leave, you'll just have this tiny little hole in the skin that will be there for a couple of weeks, but will just close up from underneath, and there's no way that anything's going to get in there, so you can really just ignore that.
With reference to what's happened after the operation, once the operation is completed, you can return home. The anesthetic in the skin will wear off within about an hour, and then you can feel a slight discomfort on the area. The vast majority of people only call it a slight discomfort, but there are things that you can do to ease things and make it better. The one thing that we really recommend is to ice the area throughout the rest of the day. So please put an ice pack on the scrotum, not directly on the skin, but through the underwear, and ice it on and off for the rest of the day. By all means, if it becomes too cold, then stop for a little while and then start again. But that's important so that you don't bruise or you don't get swollen. We will also give you a prescription for some painkiller. The most important of those being an anti-inflammatory, so something that is not only acting as pain relief, but also helps to keep the inflammation under control, so no swelling, no bruising, and quick healing. We recommend that you take this tablet once in the morning and once in the evening with some food. Occasionally it can happen that people have a little bit of bruising, so that colors the skin, and it's something that can happen after any surgery, but please don't worry about it. With time, within a couple of weeks, that will disappear and things will look back normal. With reference to sexual life, people often ask us when they can reassume a normal sexual activity, and the answer is anytime you feel comfortable. The one thing to remember is that you might notice a little bit of blood in the ejaculate, and that can actually continue for a few weeks or even up to 6 weeks after the vasectomy. By all means, don't worry about it. It's just that the site is healing and the blood that you see coming out will soon stop. It's a normal thing and it will get back to normal very quickly.
So that pretty much covers most of the post-operative stuff. The other thing, I guess, very important to realise is that you will be walking out of here fine and the vasectomy will be finished. But in terms of it working, it does take a number of months before you're able to clear out the sperm that are already in the system. So you walk out of here pretty much as fertile as you walked in. So for at least 3 months after the procedure, you must continue to use other forms of contraception. And even when you get to the 3 months, we're then going to ask you to do a semen analysis. So we'll give you a pot and a form while you're here on the day and ask you to produce a sample 3 months later and take that to your local laboratory. And what that sample is going to allow us to do is just to see if there are any sperm left in the semen. If there aren't, we will then issue with what we call clearance, which is when we say to you, essentially, the vasectomy has worked, you can now trust it. Sometimes that first test shows a few sperm left behind. There's nothing particularly to worry about. We might just ask you to continue using contraception for another month or so before doing another test. But the simple rule is that until we've told you your vasectomy has worked, you don't trust it.
Exactly. So as Simon said, you only trust vasectomy as a method of contraception once we've proven it's worked, and this is proven with a test. Please don't feel that you can trust it after 3 months. We need to do a test to prove it. With reference to failure rate, one very important point to keep in mind is that vasectomy has got the smallest rate of failure if you compare it with any other method of contraception. So it's by far more effective than women's sterilization, is about 200 times more effective than the pill, and by far more effective than condoms. However, like anything else, can fail, and there are essentially 2 ways that vasectomy can fail. We call early failure and late failure. Early failure is when after 3 months' time, once we do the test, then we discover that there are still sperm and still sperms in your ejaculate, and therefore the procedure has not worked. That is because your body's been very good at healing, and the vas that we've operated on have rejoined quickly. Although this is a bother because we have to do the procedure again, but it's not the end of the world, because that's exactly why we do the test. So we're going to test and find out that it's failed, and we'll redo the operation for you for free without charging you any money.
And the chances of that happening is about 1 in 300 people have a vasectomy, which, if you turn it around the other way, is a 299 out of 300 chance of it working.
I mean, put it this way, we do more than 1,000 vasectomy a year, and sometimes in a year we don't have to redo any procedure, and sometimes we'll have to redo 1 or 2 maximum. With reference to later failure, this is a very rare occurrence. However, it happens, and we want to make sure that people know about it, because like anything else in life, it can fail, and if that happens, it's a relatively bad surprise, I would say. However, it's not something I would lose sleep on. Later failure means that at some stage down the line, 5 years, 6 years after having had the vasectomy, then you can become fertile again, and therefore your partners can get pregnant. Having said so, as said, if you compare this one with any other method of contraception, the failure rate is very, very low. It's just about 1 in 5,000. So it's a very unlikely event.
Yeah, absolutely. So something to bear in mind, but really not anything to get too concerned about at this stage. There are a few other little bits and pieces about vasectomy that we'd like you to know about. There is a condition called chronic testicular pain syndrome. Again, one of these things that it's good to know about, but not to get too upset or wound up about. A small proportion of men can find that after they've recovered from the vasectomy and they're feeling fine, they can start to develop some pain in their testicles, maybe weeks, maybe months, or even years later. There's a number of reasons why this may occur, but it appears generally to be to do with a bit of inflammation in around the area, or maybe some changes to the nerve endings. In practical terms, we'll find this we'll get a phone call from someone maybe once or twice a year with this sort of condition. And if this occurs, almost always we're able to manage it with a short course of medication, which just calms everything down and then it settles down. It'd be extremely rare for it to go on for a long period of time. So worth knowing about, but again, wouldn't get too worried about it. Another question that's brought up and has been brought up in the press from time to time is this link between prostate cancer and vasectomy, or supposed link. There is, and proven time and time again, that there is no link between the two. In fact, the link appears to be due to the fact that men who have vasectomies on average tend to be wealthier and healthier and therefore live longer. And unfortunately, if you live longer, you're more likely to get prostate cancer. So the link isn't that the vasectomy causes the prostate cancer, it's just that you're likely to live longer and develop it. So again, not something to particularly worry about. It's important to realise that vasectomy is a permanent procedure, and so you shouldn't go ahead with this unless you're 100% sure that you don't want to have more children. Reversal operations are possible, but they don't work all the time and they are very expensive. Occasionally, even though a man might be sure, he might want some sort of insurance policy, and some guys do choose to freeze some semen down before they've had their vasectomy and then put it away just in case they change their mind in the future. That is possible. It's not something that we ourselves organise, but it can be organised through some other clinics around New Zealand, and our nurses can give you some information on that if that's something you want to consider. So, in short, vasectomy is simple, it's straightforward, it's relatively painless and very quick. So whatever you do, don't worry about it and we'll look after you.